Good morning, everyone. I'm Steve.
And I'm Scott.
And together we are Backyard Musings, broadcasting live from Apple Valley, California. Thank you for joining us. We are the Science and Technology Channel. All things exciting, breakthroughs, we're bringing to you.
And if you didn't realize that, just listen to us.
Right. We'll tell you.
Yep.
New research suggests that commonly used medications like antibiotics, antivirals, and anti-inflammatories could lower the risk of dementia. That was interesting when I saw that.
These are topics with a great message.
Yeah, for the middle-aged. Yeah. This new study leverages data from over 130 million people. That's a good sample.
Country.
Indicate
Maybe not just from here, though, right? They may have done it all over.
It might have been from UK. A lot of this stuff comes from UK. Like they got a robust medical collection, data. So indicating that repurposing these drugs might fast-track effective treatments and alleviate the global dementia burden, potentially revolutionizing care for this devastating condition. Stay with us on this because just these common things that you could take can help prevent dementia. Would you like to know more?
Okay, so new research analyzing healthcare or health data from over 130 million people suggests that antibiotics, antivirals, vaccines, and anti-inflammatory medications may be linked to a reduced risk of dementia. The study, led by scientists from the University of Cambridge and the University of Exeter, identified several existing approved drugs with potential to be repurposed for dementia treatment. Dementia is one of the leading causes of death in the UK, significantly impacting individuals and their caregivers and families, right? We've talked about this. This is it's like a long goodbye type thing.
Yeah.
The global economic burden of dementia is estimated to exceed $1 trillion.
Yeah.
That is
cost of healthcare and
a lot of zeros.
Missed work and stuff, you know, taking care of family and stuff. Or built like our neighbor built an addition to care for their parents,
right?
So that addition, the parents had their own living quarters and stuff.
Which was probably overall was probably cheaper than putting them in a facility because those facilities are not cheap.
Yeah. Despite extensive research efforts, progress in finding drugs that can slow or prevent dementia has been limited until recently. Available treatments primarily manage symptoms with only modest effects. New drugs such as lecanemab, is that like something spelled backwards? Bamanacal? Lecanemab.
And then its cousin.
Lecanemab.
And then its cousin.
I just saw it, man. Donanemab. What's up with the mab ending? All right, sorry. Have shown promise in slowing the progression of Alzheimer's disease by reducing the buildup of amyloid plaques in the brain, a hallmark of the condition. However, the National Institute for Health and Care Excellence, NICE, determined that their benefits were not sufficient to warrant approval for use within the NHS.
Why?
I don't know.
Again,
it's a lot of data, 130 million.
I do, and I know, but I'm thinking that there's a lot of people out there that would just be willing to just try this stuff, because what do they got to lose? Anyway, scientists are increasingly turning to existing drugs to see what they may be repurposed to treat dementia. As a safety profile, kind of like COVID, right? They were using some of the old stuff that was tried and true. As the safety profile of these drugs is already known, the move to clinical trials can be accelerated significantly. Dr. Ben Underwood from the Department of Psychiatry at the University of Cambridge and Cambridgeshire and Peterborough National Health, is that National Health?
So NHS, National Health
Services Foundation Trust said, quote, "We urgently need new treatments to slow progress of dementia, if not to prevent it. If we can find drugs that are already licensed for other conditions, then we can get them into trials and crucially may be able to make them available to patients much, much faster than we could do for an entirely new drug."
Because it's already out there. Yeah.
The fact that they are already available is likely to reduce costs and therefore make them more likely to be approved for this in the NHS.
Yeah, so I take Wellbutrin. I think that's how you pronounce it. And primarily it's like a mental health drug, but it's repurposed to help give me focus, so I can have focus for a short burst of time. So that's a repurposement. It has dual,
Can you take that as needed, or do you just take it automatically?
I just take it just to clear up, any fog, and
so
when I need mental acuity.
Once a day, or
yeah. Not at night. It's a little bit of a stimulant, so I take it in the morning.
Gotcha.
Yeah. In a study published January 21st in Alzheimer's and Dementia, Translational Research and Clinical Interventions, Dr. Underwood, together with Dr. Ileana Lorita from the University of Exeter, led a systematic review of existing scientific literature to look for evidence of prescription drugs that altered the risk of dementia. Systematic reviews allow researchers to pool several studies where evidence may be weak or even contradictory to arrive at more robust conclusions. In total, the team examined 14 studies that used large clinical data sets and medical records, capturing data from more than 130 million individuals and 1 million dementia cases. That's a lot of data. That's good. Yeah. Hopefully they're using AI computers to comb through that.
Speed that up.
Yeah. Right? Although they found a lack of consistency between studies in identifying individual drugs that affect the risk of dementia, they identified several drug classes associated with altered risk.
One unexpected finding was an association between antibiotics, antivirals, and vaccines and a reduced risk of dementia. This finding supports the hypotheses that common dementias may be triggered by viral or bacterial infections and supports recent interest in vaccines, such as the BCG vaccine for tuberculosis and decreased risk of dementia. Okay, well, that's been around for a while.
So I want to say that again: antibiotics, antivirals, and vaccines. Okay, all right, cool. Anti-inflammatory drugs such as ibuprofen were also found to be associated with reduced risk.
Okay, that's pretty common.
My wife can't take that. She has an allergic reaction to Ibu.
Really?
She's got to use Tylenol.
Oh,
and she gets some pretty good headaches.
So the acetaminophen doesn't affect her then. Yeah. This doesn't have that in it, I don't think. So
inflammation is increasingly being seen to be a significant contributor to a wide range of diseases, and its role in dementia is supported by the fact that some genes that increase the risk of dementia are part of inflammatory pathways.
Huh.
The team found conflicting evidence for several classes of drugs with some blood pressure medications. So blood pressure, I take not a statin, but losartan. I think it's losartan for blood pressure. And antidepressants, that could be bupropion. And to a lesser extent, diabetes medication, that could be metformin. Associated.
What's that other one? What is that other thing? Metformin, and then there's something else that starts with an L. Now, anyway, I can't remember.
Associated with the decreased risk of dementia, and others associated with increased risk.
Dr. Ileana Lorita from the National Institute of Health and Care Research Applied Research Collaboration, Southwest Peninsula, University of Exeter said, man,
it's a big name.
A whole paragraph.
That's a big name.
To what she said. Because a particular drug is associated with an altered risk of dementia, it doesn't necessarily mean that it causes or indeed helps in dementia. We know that diabetes increases your risk of dementia, for example. So anyone on medication to manage their glucose levels would naturally be at a higher risk of dementia, but that doesn't mean that their drug increases your risk. So that's good to know.
Quote, it's important to remember that all drugs have benefits and risk. That's for sure. You read some of these and could cause brain hemorrhage and death. What?
Some of the side effects on some of these drugs are, why would you want to take it? Vomiting, nausea, pregnancy. You end up getting pregnant taking these pills, it seems like.
So, from the clinicals, they have to report every side effect that occurred.
I guess. Even if you ate some bad fish food, right? I mean, what do you do? Anyway.
You should never change your medicine without discussing this first with your doctor. My wife always tells me that because I try to get some of her muscle relaxants. And she says, Steve, these are for me. I'm like, come on, honey, you can spare one. Come on.
And you think that's supposed to happen. But anyway.
So I got my own. Muscle relaxants, Sheriff Steve. What do you say about that?
Okay. Steve's Pharmacy and Science and Technology Network.
And you should speak to them if you have any concerns. The conflicting evidence may also reflect differences in how particular studies were conducted and how data was collected, as well as the fact that different medications, even within the same class, often target different biological mechanisms. True.
Okay. The UK government is supporting the development of Alzheimer's trials platform to evaluate drugs rapidly and efficiently, including repurposed drugs currently used for other conditions. Quote, pooling these massive health data sets provides one source of evidence which we can use to help us focus on which drugs we should try first. It's according to Dr. Underwood. Again, we're hopeful this will mean we can find some much needed new treatments for dementia and speed up the process of getting them to patients. Yeah.
Yes.
We love that.
We've had a bunch of segments about Alzheimer's, you know what I'm saying?
Right.
And it just looks so promising. All these things that are going on to treat that disease.
Yeah. Yeah.
And I hope we can eradicate it, start with, reducing it and preventing it and then eradicate it. Like
I would love to see
polio.
something like that and cancer in my lifetime. And, well, we're going to talk about that in this next segment, but this AI stuff is just fascinating. We're able to speed up that process.
Fascinating.
Yeah.
And the quantum computing, once it gets up and running, that's going to put AI and quantum computing together. Yeah. It's just crazy fast.
Why is it taking so long to do that? So everything, it's all in God's time, right?
And we saw that there's breakthrough like that thin wafer. Remember that they're replacing copper wires. I mean, right. This is all separate people in Korea researching, people in Europe and here and Italy, and they're all researching, doing their little thing, and it's just got to come together.
Right.
You know what I'm saying?
Yep.
In a world order, come together. I'm just kidding.
Scratch that. Okay.
Thanks for joining us, folks. We'll catch you later.
Take care, everyone. Thanks. Yeah.